Welcome to the American Journal of Sports Medicine's 50th anniversary celebration. I'm Michael Angeline, Electronic Media Editorial Board member at AJSM. Today, I'm speaking with Dr. Jack Unverferth. He and his co-author, Dr. Melvin Alex, had the most cited AJSM article in 1973 entitled "The Effect of Local Steroid Injections on Tendon." Welcome, Dr. Unverferth. Thank you for joining us. I hope you've been staying safe during the COVID-19 pandemic.
Thank you for having me.
As part of our celebration campaign, we are highlighting the most cited article of each year throughout the journal's 50-year history. Dr. Unverferth, what led you to focus on the impact of local steroid injections into and about tendons?
Well, that was 50 years ago, a long time ago. And in the early 70s, the injudicious use of steroid injection into patients that came in with some form of tendonitis was used very, very frequently. And in a short period of time, 5 patients presented themselves, all athletes, to our office with traumatic tears of their tendons following steroid injections. And they were sent to us. None of them were our patients, but they were sent to us to do the repair, the cleanup and the repair. And when we got into the operating room, we noticed that these tendons that had been injected with steroid prior to the rupture, that they really looked destroyed. It was like quite different than when someone without a steroid injection tears their Achilles tendon. This was a lot uglier. It was harder to debride and harder to repair. Obvious evidence of steroid deposits, a lot of thickening of the tendon sheath. And so those 5 patients in a short period of time had us sit down and say, hey, let's look at the literature and let's see what's out there. And so I did. And I was only able to find 2 other incidences quite early, 57 and 67, I think, where the authors also claimed that their patient had been injected with steroid and then went on to rupture. So I sat down then and we designed a lab study to look at the possibility that steroids were a detriment. Everyone at that time thought they were helpful because after receiving a steroid injection, the patients usually felt pretty good at 2 or 3 weeks. And so when they would come back because they were feeling better, they would ask to be reinstated. They will get back to the sport. And of course, very soon, then they would get symptomatic again, come back in and get another shot. So that was the cycle that we saw repeated. So it was because of that that I and Dr. Alex decided to do this study.
And based on that, what impact did the findings of your study have on your practice of orthopedic surgery? And what do you think the overall arching sort of impact was in the field of sports medicine at that time?
Well, I feel that article definitely had the physician stop and think for a moment before injecting a tendon. Also, I think they never thought about whether or not that steroid injected was going to be soluble or insoluble. Because they were feeling better, they were given a false sense of security, which plays a big role, and that led to the recurrent tears. I think that the article had people then start thinking about, hey, maybe we shouldn't do this. If we do it, do I want to inject it into the tendon or just around the tendon? How soon can I let them go back? Is there anything else that we can do for them?
And with that, given all the technological advancements in medicine, retrospectively, is there anything you would do differently or you wish you knew at that time frame with respect to your study?
Well, I think imaging has played a big part of the treatment for this. Today, if someone comes in with a bad tendonitis, the physician can get a handle on how bad it really is. Is it bad enough to take to the operating room and do a debridement, tenosynovectomy? I doubt whether or not today anyone will go ahead and inject that tendon directly. But a long-term physical therapy program, conservative management, rehab, probably would be the way it would be handled today. And I think that's because of the MRI, the ultrasounds, and the CT scans.
Any thoughts on the new biologic wave, PRP, and all the new modern technological whizzes that we have in medicine?
Well, that's interesting because I just went through a long series of PRP into my back because of severe low back pain. And I think that because of that today, if the physician identifies a patient with significant tendonitis, significant destruction of the tendon, then I can imagine that they would go in, the surgeon would go in, debride it, and use PRP. I think that's out there now. It certainly wasn't out there in 1972, but it's there today.
Now, in closing, what suggestions would you have for new authors based on your research and experience in the field of orthopedics?
Well, research is fun. It's challenging. It takes a lot of time. And my advice to a young man or woman who wants to get into that kind of thing is, for a particular topic, pick one that really interests you. Go to the literature like we did and see what's been done about it. And then I think most importantly, get around you a team of people that can help you. In my case, I had my mentor, Dr. Mel Olix. Dr. Olix, incidentally, was one of the 50 original members of the American Orthopedic Society for Sports Medicine. And so he was a big influence on me. Then, in doing the paper, I got the assistance of Patel Institute. Patel is a research institute right in the shadows of Ohio State University. That's all they do is research. And I was able to make contact through some people at Ohio State with some engineers over there, and they helped me set up the study. That involved the rabbits, 18 rabbits. It involved feeding the rabbits, taking care of them. And then in writing the paper, I had actually, there was an editorial staff at Riverside that helps with the language that you choose. We had pathologists at Riverside and University contribute with the microscopic and macroscopic studies of the tendon. So we had all sorts of help. And I think in today's age, if you're going to really get into that kind of thing, you really need that kind of environment. It's going to be too difficult.
Great. Thank you, Dr. Unverth, for your time. He and his co-author, Dr. Melvin Olix, had the most cited AJSM article in 1973 entitled "The Effect of Local Steroid Injections on Tendon."